Do you have a noise in your ears that you hear mostly all the time? Could be a buzzing or a ringing sound. Let's talk more about what that sound is and what we could possibly do about it. Noises that happen in our ear that might be ringing or buzzing that have been there for more than 3 months are typically categorized as tinnitus. Yes, it's tinnitus and not tinnitus. The reason it's not tinnitus is because an itis suggests an inflammation, and for what we know about tinnitus, there isn't an inflammation that we can cure. Usually why we have the noise in our ears could be a lot of reasons, but typically it goes along with having some type of hearing issue. If we've been exposed to loud sounds when we were younger or even immediately after something very loud, we might have some noise in our ears. If it's there for 3 months or longer, we might be saying that it's a little bit more permanent. When we have a hearing loss, our brain is trying to compensate for a lack of stimulation that our brain is now missing. And your brain is very aware of it. Whether or not you feel like you have a hearing loss, your brain says, something is missing. And it comes out as this distorted sound, which is almost like a neural misfiring. And since your world is a little quieter from having not as good hearing, that noise in your ears is a lot louder and your brain can't tune it out very well. Some people try certain types of tactics to make that noise feel like they don't notice it. Most people will try things like masking, which is just covering up the sound. That's usually not a long-term effect. It's usually short-term. In the moment, you might notice that it's better. Another type of therapy could be a cognitive behavioral therapy. Cognitive behavioral therapy typically doesn't change the volume of the noise, but helps you get to the point where you can tune out the noise in your ears. Another type of therapy is something that we typically use through hearing devices, where the hearing device is programmed based on your frequencies of hearing loss. It does give your brain the information it's been missing, and in doing so, your brain has more to attend to. But also, because your brain is paying more attention to that sound in those certain frequencies, it can tune it out. And when we add something like a sound therapy, usually in the sound of ocean waves or in that frequency range, it gives your brain something pleasing to associate with that annoying sound that you normally have. So when we hear better, we hear less of our own noise in our ears. And when we have the ocean waves that are associated with that little annoying sound, our brain tends to tune it out much faster. So it teaches ourselves how to get relief and how to keep it.